One of the most common and one of the most important problems patients present with in my clinic is heart blood stasis. In fact, I consider heart blood stasis an early sign for serious health problems such as ischemic heart disease. So when I see this blood stasis in my clinic, I take this very seriously. Why? Because heart blood stasis and ischemic heart disease are both created from the same problem. That is a lack of blood, oxygen, and nutrient flow moving into the heart wall. When the heart muscle is getting an inadequate supply of blood, oxygen, or nutrient, the heart starts to get tired, it gets anemic, and the heart muscle doesn't work as good as it used to. But let me ask you this question. Do you consider a 40, 50, 60, 70% blockage through the coronary arteries, those arteries that feed the heart muscle, healthy? Do you consider this healthy? Of course not. But this is what we're accepting as patients with routine medical testing when it comes to heart disease and heart health. In fact, the first sign of heart disease can actually be a heart attack. And obviously this is way too late. So, in the next part of this video, I'm going to talk about what the Chinese call heart blood stasis and what insights this could give us in detecting early stage heart problems. So, what are these early stage signs and symptoms of heart blood stasis? Firstly, using pulse diagnosis, there will be a blocked radial artery, specifically at the corner of the left wrist crease. To identify this pulse correctly, the doctor has to start gently at that superficial, at that top layer of the skin, and gently, gradually push down in towards the bone. When it comes to heart blood stasis, this radial artery will be quite undefined. It'll be very difficult to feel. In fact, sometimes you have to push right down deep in towards the bone to actually feel a very small amplitude in these early stages of heart blood stasis. Compared to a normal radial pulse in this area, it's basically like putting your finger on a bunch of mud. In Chinese medicine, this is directly associated with the heart, and it's associated with inefficient blood, oxygen, and nutrient circulating through the heart. This blocked pulse at the end of the left wrist crease has been anecdotally associated with heart blood stasis after hundreds of thousands of patient visits, primarily conducted by Robert Doan in the USA and Dr. Jimmy Chang from Taiwan. When talking about heart blood stasis in Chinese medicine, basically the Chinese figured out that there was two categories of symptoms, those that are early stage symptoms and those that are late stage symptoms. Patients with this blocked pulse will be tired, they'll be fatigued, they won't sleep very well, they'll have insomnia, either they'll have trouble falling asleep or they'll be waking up through the night and feeling unrefreshed in the morning. They'll be prone to anxiety and anxiousness, and they'll sometimes experience heart palpitations. And by fixing this heart blood stasis, the fatigue, insomnia, anxiety all improve very quickly. And when palpating the radial artery, that pulse will actually start to come back up to that superficial level and feel normal again. But you might be wondering, what are those later stage signs and symptoms of heart blood stasis? So that first sign, the blocked pulse in that left radial artery, perhaps we may have felt just a little bit of blood flow moving through in the early stage signs. But in terms of the late stage sign, they'll be completely blocked up. There'll be no blood flow whatsoever moving through. There'll be no amplitude. It'll be like putting your finger on a dead pulse. So when it comes to these late stage symptoms of heart blood stasis, it starts to actually line up with the same symptoms as Western medicine. So we start to see chest discomfort, we get the referred pain down the left side of the arm, etc. But also the fatigue, anxiety, insomnia will still be there, and that blocked pulse in the left radial artery will get even worse. However, the problem is that these late stage symptoms often don't start until blood flow through the coronary artery supplying the heart is more than 70, 80, 90% blocked. An example of this is the treadmill stress test. Basically, the patient won't fail the test unless they've got a 70, 80, 90% blockage in the coronary arteries. Now, this is one of the reasons why so many people are dying of ischemic heart disease, because these problems are picked up way too late when these vessels are already blocked 70, 80, 90%. So the problem with these late stage symptoms is that this chest discomfort, etc. won't begin during exercise until the coronary arteries are more than 70% blocked. And it's even worse at rest. These coronary arteries need to be sometimes 90% blocked for those symptoms to start to develop. However, in Western medicine, they'll even agree that sometimes no symptoms are present whatsoever before serious cardiac events. So in my opinion, Western medicine is the best, the very best in the world when it comes to emergency medicine and trauma care. For example, if you're having a heart attack, or if you've got some sort of emergency situation, your first, most obvious choice is to go to the hospital. However, Western medicine is often blind to these earlier stage problems that lead up to that point in the first place. However, Chinese medicine is not an emergency medicine. It's a chronic disease medicine. It's not good at emergency situations. However, it's exceptional at detecting early, middle, late stage problems and then fixing those problems before they get to a critical stage, before they get so bad that the person has serious problems. In fact, when it comes to heart-blood stasis, I believe this is where Chinese medicine can really shine, because it has figured out a way to detect early stage heart-blood stasis and how to treat it effectively. Heart-blood stasis and ischemic heart disease both come from the same underlying problem, which is poor blood, oxygen and nutrient flow moving into the heart. And Chinese medicine has figured out a way to encourage blood flow into the heart so it can improve the health of the heart and improve longevity. So when treating that heart-blood stasis, we want to see that the fatigue, anxiety, insomnia, and heart palpitations all getting at least 50 to 80% better in the first 4 weeks. And as we continue to treat this over 3 to 5 months, we want to see those symptoms stabilize and get a lot better to the point where the patient can stand on their own 2 feet without any Chinese herbal medicine. Before stopping treatment, we want to ensure that that left radial pulse at the end of the left wrist crease comes up into its normal position again, back up into that superficial level of the skin where there's a nice healthy convex pulse jumping up against the finger, not too strong or not too weak. So thanks for listening, guys. If you have a question related to this video, please leave a question in the comment section below. If you really like this video, give it a big thumbs up. And if you like the content of this video, please subscribe to my channel to receive more content just like this. Until next time, be grateful and take care.